All right. Hello again and welcome everyone. I'm Nuri from the Massachusetts Health Connector, and I'm joined by my colleagues Nikki, Thalia, and Melissa, who will be presenting today's information. Together, we are here to share information about the Health Connector, who we are, 2024 health insurance coverage, and the options available, whether you're considering it for yourself or your family. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we just want to share some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout, but we do expect to receive a lot of great questions, so we will do our best to identify the overarching themes of your questions and answer as many as possible in the time that we have together. We ask that you please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. Lastly, we are recording today's webinar, so following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. And with that being said, I'll hand it over to my colleague, Nikki, to get us started.
Thanks so much, Nuri. And again, thank you everyone for taking the time out of your schedules to hear this information today. So as Nuri mentioned, we're going to go over health insurance options for Massachusetts individuals and families, and we'll talk about how you can get coverage through the Massachusetts Health Connector. So today's agenda, we'll talk about what the Health Connector is or who the Health Connector is. If you are someone who's looking for health insurance coverage, we'll talk about the steps and deadlines for accessing coverage, enrolling into health insurance coverage. And then my colleague, Thalia, is going to take you through what you should know about 2024 coverage, how what has changed, how things have expanded, what new plan options are available for you. And something I know that we all do when we shop. We want to compare our options and see if there's a way that we can save some dollars each month. And then lastly, we know that this is or could be a new process for you. We'll talk about different ways in which you can get help completing an application, choosing a plan, and enrolling into coverage. So I will start with what the Health Connector is. So we are the state's health insurance marketplace. We are here to offer individuals, families, and small employers access to affordable health insurance coverage. So you may be wondering, who are the individuals, who are the folks that get coverage through the Health Connector? And it's really those who don't have access to employer-sponsored insurance, either through a job or a spouse or a partner. And a lot of people who apply through the Health Connector qualify for help. Do offer a lot of savings, and I'll step you through what that looks like, and Thalia will give you even more detail about that. Now, you'll also hear us today talk a lot about health insurance coverage, but it is really important to note that people can also buy dental insurance through the Health Connector. And lastly, it's important for me to include that small employers with less than 50 full-time employees can also access health and dental coverage through our Health Connector for Business platform. This is not something that we will go through on today's webinar. However, if you are a small business owner and are interested in learning more about Health Connector for Business, please do either check our website or Eventbrite, and you can see the webinar schedule for Health Connector for Business. Now, I want to go through a couple of things related to Health Connector plans. First and foremost, it's important to acknowledge that all the options, all of the health and dental plans that are sold through the Health Connector meet state and federal standards for coverage. So what does that mean for you as a consumer? You know that these plans are comprehensive. For those, we're in Massachusetts, so it's important to note that you'll never be penalized if you are purchasing coverage through the state's marketplace. When you go to file and reconcile your taxes, you can feel confident that all of the plans meet our state requirements for health insurance coverage. So technically, what are these plans known as? These are known as qualified health and qualified dental plans. And the way it works is depending on where you live in Massachusetts, you're able to choose from a variety of carriers who offer coverage in your area. Now, I talked about savings, and again, Talia is going to go into this in more detail later, but there are two ways that people can get help paying for their plans. Health plans with advanced premium tax credits. Because we're the state's health insurance marketplace, we are the only place that someone can get advanced premium tax credits that allow them to reduce the cost of their monthly premiums. And then, unique to Massachusetts, we have what's known as the Connector Care Program. And people who meet certain criteria may qualify for low or no cost insurance coverage. Again, this is comprehensive coverage. And this year, there are even more carriers who are participating in this program. Now, we are in February, and I just want to acknowledge some things. We have at the Health Connector what's known as an open enrollment period and then a closed enrollment period. So our open enrollment period runs from November 1st through January 23rd. That's typically when open enrollment runs. We run our open enrollment every year. Now, what open enrollment means essentially is that anyone who needs health insurance coverage can look to us during that time frame, and they don't need to have any particular qualification, or they don't need to, and I'll explain that exactly, but essentially it's the time for existing members to compare their options for the upcoming year. And it's a time for new members to come in, apply, and see if they qualify for some type of coverage. Now, beginning on January 24th and through the end of October, we are in what's known as a closed enrollment period. However, you do not need to worry because there are all types of things that happen in someone's life that would allow them to have a special open enrollment period. And what a special enrollment period means is that if you have a certain type of qualifying life event, you can still come in, enroll in coverage, or even change health insurance plans outside of that November 1 through January 23rd timeline. So what is a qualifying life event? Those are things like a change in your household size, a change in income, if your income goes up or down. Let's say there is an update to someone's immigration status, or even a move, let's say into Massachusetts or from one part of Massachusetts to another part of Massachusetts. There are a number of qualifying life events. We have a complete listing on our website. And what is important for you to acknowledge is that if you have a certain type of qualifying life event, you would need to report it within 30 days of it happening. And then you have 60 days from the date of the qualifying event to take action. So you either want to select a different plan or select the plan that you're going to enroll in. Now, again, we're in February, so this means that if you are interested in coverage that's going to begin on March 1 or April 1, you can take action now, apply, and see if you can enroll in coverage during that time. Now, just because we're in a special enrollment period, or you'd be in a special enrollment period, please note that all other deadlines do apply. So you would still need to pay by the 23rd of the month, and you would need to choose your plan by the 23rd of the month. And we'll talk about that in more detail. Okay, so I started telling you a little bit about this. So what are the steps? What are the deadlines for? Ooh, and I'll need to stop. I should have, sorry, Neri. I should have paused. You had said we're going to pause in between and take at least one common question that people have. So I'll pause.
Yes, thank you, Nikki. So Nikki, you went into a little bit of detail about health coverage and dental coverage as well. But do you mind just touching on vision coverage and where that falls into play?
Yep, absolutely. So the Health Connector sells health insurance as well as separate dental insurance. We do not sell separate vision insurance. However, the carrier or the health plan that you enroll in might have certain types of vision benefit, and that will vary by carrier. So we can talk more about this later, but there is something known as a statements of benefits and coverage, and that's where someone can see plan detail. So if you're comparing between 1 and 2 plans, you can look at that statement of benefits and coverage and say, oh, well, this one has some vision benefits that could be helpful to me.
Thank you, Nikki. And I said I would ask one question, but if I may, I have another quick question regarding special enrollment periods, since you just touched on that. Does aging out of a family health insurance plan qualify as a life event to open up a special enrollment period?
Yes, it does. Thank you. That's a great example of what would allow somebody to qualify for special enrollment event. All right, so I will slow down a bit, and I promise to stop before we get to, I'll go through this section, then stop if you have any other questions. So in this section, I'm going to talk about the steps and the deadlines for applying and enrolling into health coverage. So here, I'm just showing you what the application for individuals and families looks like. If you go to www.mahealthconnector.org, you're going to see a different landing page. However, this is the page for the application. So whether someone is an existing member or someone is newly applying, this is really where you would start. It's important for me to acknowledge that we have the application available in English. It's also available in Spanish and Portuguese. Now, there is only one application in Massachusetts for Health Connector coverage, for finding out if you qualify for help paying for Health Connector coverage, or even the Mass Health program. So really important, if you look on this page at the top, you'll see the Health Connector logo, the Mass Health logo. We are not the same organization, but we work very closely together. And what this system does, what this application does, is you complete it. You don't need to know what you're applying for, essentially, but the system, when you enter all of your information, it will tell you if you qualify for a Health Connector plan, or if you qualify for Mass Health, which is our state's Medicaid program. On the screen, you see 2 red circles. Now, this is also really important. If you have ever completed an application with us or Mass Health, what you want to do is sign in. You do not want to create a new account. If you have forgotten what your username or your password is, you can go through the sign-in process, or you can call customer service and get a little help getting into the online application. Now, if you are newly applying, what are the things you need to consider? I've been saying that we're the Massachusetts Health Connector, so you need to be living in Massachusetts. You need to be a US citizen, a US national, or otherwise lawfully present in the US. And you need to be someone who doesn't have access to another type of health insurance. So for example, you can't have access to insurance through an employer or through a spouse's insurance coverage. Also, if you are already enrolled in Medicare you're already enrolled in Medicaid or other public coverage. So there are certain types of veterans benefits that are comprehensive enough, which will mean that no, you aren't going to qualify for Health Connector coverage. Also, if someone is incarcerated, they're not going to be able to qualify for this coverage. So if you wanted to get started, what would you need? You would need social security numbers for everyone who's applying. You'd need any immigration documents if you have them. And if you have any questions about, what something is, you can go to our website and you can just compare and contrast your documents against what visuals we are showing there. And then also, we're going to need recent pay and income information. So if you are working, copies of your last 2 pay stubs. If you are a self-employed person, so we have a lot of, what are people calling themselves? Solopreneurs, young entrepreneurs, any type of entrepreneur, and they're self-employed. Their tax documentation, we would want to understand or have information about their net income. Now, if somebody is unemployed and they're applying for coverage, we're going to need to see, and this is known as a monetary determination. Basically, we need to know what your unemployment, their website or off of the letter that you've received. Now, as you're looking at these lists, if you're thinking, okay, I don't have all of this information, what should I do? Should I not apply? The answer is, don't wait. It's okay. Give us what you have. And if the system can't give you an answer at the end, or if you need more information, it will indicate that. So you're actually going to get a message at the end of your session that will tell you if you need to provide more proof, more information. So here are questions that we typically get. So when somebody is starting their application or working to complete their application, there are a lot of types of income sources, and you may be wondering, okay, is this something I need to provide? So if you, like we were just talking about, if you're unemployed, yes, you need to include that. If you're collecting Social Security, including disability, yes, you need to include that as income. If you're collecting alimony, etc., these are the types of things that need to be added and included as part of your income. What doesn't need to be covered, so if you, or included, pardon me, if you are receiving child support, if you've received, monetary gifts, or SSI or veterans disability, these are the types of things that do not need to be included as income. As well as if there are dollars that an employer takes out of your paycheck. So if they're taking dollars out for your health care, for health insurance, for retirement, these are non-taxable items, and these don't need to be included as income. Okay, so let's say you apply for coverage. What do you need to do after? When you get through the whole application process, you're going to see a result on screen. But in addition to that, we are required to send you mail. It is required by law to send you mail from the Health Connector as well as Mass Health. If you don't have all the information on your application that we need, there will be a letter asking for more information. Really important to send in any documents you owe, and you'll have a timeline, a time frame that you need to send that in, so that can help you avoid any issues. Now, we know that when you're going through the online application, when it comes to income, you're going to be asked about what you are currently making, and then you're going to be asked about what you think you're going to make for the whole year. That could change, as we know. So as you're going through the year, if there are any changes, whether it's a change to your household size, whether it's a change to income, all kinds of things can happen in a year. It's really going to be important for you to keep your application updated and as accurate as possible, because that helps you get the right amount of help paying for your health and dental insurance. And it also gives you the most correct amount of advanced premium tax credits. So I want to just pause there for a moment. These advanced premium tax credits, these tax credits get reconciled when you are balanced. Maybe balance is a better word. When you file your taxes at the end of the year. So you are not required to take the full amount of tax credits that you're eligible for. You can reduce that amount. So we'll talk about that in more detail later, but at a minimum, I think the key takeaways from this slide are you'll see a result when you get to the end of the application, but you'll still get mail from the state. And after you complete your application, if there are any changes that you need to report, you can do so on your own by just going back into your application. Now, Nuri, before I hand this over to Thalia, are there any questions that came in that I can address?
Yes, thank you, Nikki. So the first question is related to employer-sponsored coverage and employer-sponsored insurance. So let's say I'm in a scenario where I do have access to insurance through my employer, but it is a little bit too expensive. Am I able to decline that insurance and get covered through the Health Connect, or at least apply? What would be your recommendation if I am in this scenario?
Yes. So absolutely. If you are employed and you have access to employer-sponsored insurance, but when you look at that pricing, it seems or feels unaffordable to you, there is a worksheet that you can access on our website that you can go to your employer. They can work with you. Yeah, we need to have detailed information about the plan, how much they're going to contribute, what the total cost is that you would be responsible for, etc. Once the system has all of that information, it can do a determination to see whether or not, using the state guidelines, that health insurance plan is considered affordable. So it really depends on, it's a case, I don't want to say it's case by case basis, but there are standards for affordability. And if someone feels that the plan that they are offered through their employer isn't affordable to them or to their family, there is a little bit of homework that you need to do, but you can enter all that information into the application and see whether or not it meets the requirements.
Thank you, Nikki. I do want to ask about Cobra, but
Yes.
I'm not sure if you would like to speak about it at this point in time.
I'm happy. I know that I feel like this is the time of year that this comes up quite a bit. So for those of you who don't know what Cobra is, I'll just say that if you have been working and have been, you've been covered for your health insurance. Sorry, let me start that sentence over. If you're getting health insurance coverage through an employer, but then you either leave your position, you've been laid off from your position, for some reason you have left that position, but you have been offered to continue your health insurance coverage through Cobra. It means you can stay enrolled in your health insurance plan, but the employer does not typically contribute any dollars to that monthly premium. So you essentially would be paying the full amount of money for that health insurance plan. So we usually get this question around this time that says, okay, well, what if I'm in Cobra and I just realized how expensive it is? During open enrollment, if somebody is in Cobra and wants to quote unquote get out, you can come in, essentially no questions asked, and you can enroll into a health connector plan and drop the Cobra. Now, when you are outside of an enrollment period, you can't necessarily just drop the Cobra, because once you do enroll in it, you're required to stay in it until you either get to the next year's open enrollment period, or there are exceptions. So one of the exceptions is that, let's say you were offered COBRA and the employer said, you know what, I'm going to give you some money for the next 3 to 6 months to help pay for that COBRA. So you decided it just makes sense. I'm going to stay in COBRA. They're still going to give me money for 6 months. If you're in a situation like that and the dollars that they're contributing end, you can in fact get into Health Connector coverage when those dollars end. So Nuri, I hope that helps answer any questions that have come up related to COBRA.
Yes, thank you, Nikki. I think that covered a lot, and we can definitely revisit other specific questions related to COBRA.
Okay, great. So now I'm going to hand this over to my colleague, Thalia, and I am going to advance the slides for you.
Okay, thank you, Nikki. All right, so we want to talk about what's new for 2024 coverage with the Health Connector. So in 2024, the Health Connector has expanded eligibility for Connected Care plans as part of a pilot program. The Connected Care program, which combines federal and state subsidies, will now provide lower premiums, co-pays, and no deductibles to more Massachusetts residents in 2024. And even if you aren't eligible for one of our Connector Care plans because your income exceeds the limits, you might be eligible for the advanced premium tax credits that Nikki was talking about. And whether you select a Connector Care plan or a plan with advanced premium tax credits, you can be assured that they will both meet state and federal standards, as well as lower your monthly premium bill. Okay. As previously mentioned, whether you're eligible for the tax credits or a Connected Care plan, you still have the chance to save on your monthly premiums. With the advanced premium tax credits, the IRS will send the credits directly to the insurance company, so you'll pay less each month, and you can always decide how much of that tax credit you choose to apply towards your monthly premium. With the Connected Care program, your monthly premiums are lowered using both federal and state funds if you are eligible. And these plans have low monthly premiums, low out-of-pocket costs, and no deductibles. And I want to mention that when you qualify for a Connected Care program, you will be able to select a plan type, which is based on your income and your family size. And this will determine how much you'll pay for your monthly premium. And I will have a slide where we demonstrate all those plans and how much you could possibly pay. Also new for 2024, all insurance companies who participate in the Health Connector will now offer plans in our Connector Care program, which just means more health plan options for Massachusetts residents. And all the insurance companies are listed on the screen here, and those plans became available to those who qualify for a Connector Care program as of November 1st in 2023. So very generally speaking, that means that in 2024, individuals and families with higher incomes will now be eligible for an individual. We've increased the income limit from $43,470 to $772,900 for 2024. And for a family of four, the income limit has been increased from $90,000 to $150,000 for 2024. Okay, so as I previously mentioned, if you qualify for a Connected Care plan, you will need to select a plan type that is based on your income and your family size. The dollar amount that you see on the plans here just is the minimum amount that you could be paying for each of these plans. So for example, in this plan type 1, you could pay as low as $0. And for a plan type like 3B, you could pay as low as $96 a month. And also, sorry, just go back. And also just to reflect that increase that we were talking about for connector care plans, we've added 2 new plan types, which is 3C and 3D in 2024. All right, do you want to take any questions now?
Sure. Thank you, Talia. So, these questions relate to the previous section. I'm not sure if you or Nikki would be able to speak to them, but it sounds like folks are still interested in the qualifying life event, very specific scenarios. I'm not sure if we can share some information related to that after the webinar. But folks are interested in knowing if, retirement or leaving the job would qualify, would count as a qualifying life event. And also, specifically, like, what do people do if they do have a qualifying life event? How do they report that?
Sure, sure. We can certainly, and I think, Nuri, you mentioned this in the intro, but I think it's always good for us to repeat it again. I know people have come off and on at different times. So we, after this webinar is over, we'll send you a link to the recording. The email, there'll be an email that's associated with it where we include a number of links and any clarifying answers if there were questions that people needed more information on. So we'll send that to the entire group. And then you'll also get the presentation. So all of this information will come to you. Included in that will be a link to our website that has within our website that has a complete listing of all of the different types of qualifying events. It's very comprehensive. But things like ending a job because of retirement, and knowing in advance that you are going to lose access to employer-sponsored insurance. When you're going through the online application, you can enter an end date for your employer-sponsored insurance. And yes, that is considered a qualifying life event. So I won't spend a ton of time on this now, but we will certainly send the follow-up link, and you can see in detail what all of these things are. And I guess I can ask Nuri, I can ask you, I don't see chat and that's fine, but maybe I can send you that link if there's a way to paste it in the Q&A for perhaps. I don't know if that's possible, but if not, we can certainly, we can certainly be sure to include that link in the follow-up email.
Yeah, Nikki, that would be great. I don't think we have the ability to post something for everyone to see in the Q&A, so we can definitely include it in the email.
Okay,
Now,
fantastic. Yep.
Related to the section that Talia just presented on, Talia, if you don't mind just going back to the different plan types, giving very high level again of the key differences, particularly between those new types that were added, so 3C and 3D, anything to highlight there so that folks understand the differences among those types.
Yep. And Talia, could I start? Would it be okay if I started to answer something and then if you wanted to add in? Okay, if you want to go, oh, I was about to say, do you want to go back to the slide? I will go back to the slide. Hold on. Okay, let's just start here. So as Talia said, when you, or maybe we didn't explain this to you and we'll explain it now. When you apply, at the end of the application, you're going to get a result. Assuming you entered enough information that the system can give you a result, you will see an eligibility result. If you qualify for a connector care plan based on your income and all of your information, it will say you qualify for connector care plan type 1, plan type 2A, plan type 2B, etc. So you actually don't get to choose your plan type, but rather you're going to qualify for a particular plan type. Now, if someone's wondering, okay, what's the difference between type 1, type 2, type 3? The difference, well, let me talk about the similarities first. The similarities is that by plan type, well, actually, every single connector care plan has the same benefits. It has different, and by plan type, it has the same copay structure. So for example, if somebody qualifies for plan type 2A or plan type 2B, their copays are going to be exactly the same. anyone in plan type 3, their copays are going to be the same. So regardless of which plan type you qualify for, all of your benefits are the same. Now you might be wondering, okay, so what's the difference? Why would I choose this carrier over this carrier? What's really different between the connector care carriers that you can enroll in is the provider network. And Talia, is there anything, I probably gave more information, but is there anything else you'd want to share here? Or maybe Nuri, is there anything else you wanted us to kind of call out more?
No, that's great, Nikki. I would just highlight that we are looking at the federal poverty levels for 2024 specifically. This is what is on the slide now and will be shared after.
You got it. You got it. So yes, we're talking about plan year 24, but when we're thinking about the FPL, the application is actually looking at 2023 FPLs. So we can provide those guidelines so people can see, and I'll point you to a resource so people can see that. All right, thank you so much, Nuri. Talia, back to you.
Okay, perfect. So now we're going to look at a few things that could help new members or existing members compare options and save on their Health Connector plans. So there are premiums, which is the amount that you pay monthly for your health insurance plan. And we like to compare your premium to a gym membership, where it doesn't matter how many times you go to the gym in that month, you will still need to pay that flat monthly rate for the gym. That's how we like to compare our premiums. There are also covered benefits, which are the services that carriers agree to pay for when you enroll in their health plan. And depending on the services and the carrier, you might be responsible for paying a portion of that service. The portion that you are responsible for paying will be your out-of-pocket cost. And lastly is the network that someone chooses to enroll with, which includes doctors, specialists, and hospitals. And this will vary depending on the carrier and the plan type that you select. And I think Nikki talked a little bit about that when she was talking about the plan type, that is the difference. Our most notable tools that Melissa will go more in depth with and demonstrate for you guys is our Get an Estimate tool and our Plan Comparison tool that are available to everyone outside of their individual Health Connect or Mass Health applications, meaning you don't have to sign into your account to have access to them. These are tools that allow you to see what plans are available in your area and give you an estimate of what your savings might be. The Plan Comparison tool helps you find providers and facilities covered by these specific plans. Now, the Plan Finder tool works very similar to the Get an Estimate tool and the Plan Comparison tool, but is more precise because it's based off the information that you provided in your individual application once you've logged into your account. So after you've used these tools and you've done your research about which plan you might want to enroll in, I just want to remind everyone that enrollment is not complete until you make your premium payment. And in this case, you need to make your first payment by February 23rd in order to obtain coverage for a March 1st start date. And here we'll just get an example of what your monthly bill might look like. It'll break down your monthly premium, show the advanced premium tax credits you apply to your premium, and if you're eligible for a Connector Care for the Connector Care plan, the state and federal funds that are being added to your account. You can also make monthly premium payments one of 3 ways: online through the payment center using a checking or a savings account, because we do not accept credit cards, or by mail or over the phone. You can make these payments. Okay. And we're just going to stop one more time for questions. See if anyone has any questions about the information.
Nothing related to this section, Thalia, but just in the previous section, as we were discussing the different connector care plan types and the FPLs, what would be the case for someone who, let's say, exceeds 500%, so they don't qualify for connector care specifically, but would they be able to still apply for the health connector and possibly receive other benefits that aren't necessarily connector care plans? Let me know if that did not make sense.
Sure. So Nuri, tell me if this is what you're trying to get at. So could it be that someone is over income for connector care? So keep in mind, as Talia said, the pilot program has expanded the FPL levels to up, so people can be eligible with incomes up to 500% of the FPL. But what if someone's just over that? Is there any chance they might be able to get advanced premium tax credits? And the answer is yes. There could be people who don't qualify for connector care, but based on their income, their household size, etc., when they go to shop for coverage, and I'm gonna double check myself on the percentage. I believe it's 8.5%. If the cost of coverage is more than 8.5% of their overall income, there may be advanced premium tax credits available to them, and that will help them enroll into a plan so that they're not paying more than 8.5% of their total income. Now, the little tricky part there is that somebody could choose to enroll in a plan that's more expensive. That's totally up to them, but there could be an option of getting advanced premium tax credits if your income is over limit for connector care. Did that make sense?
Yes, thank you, Nikki. That did answer
Yep.
the question.
No worries.
And then can I just ask very quickly regarding, again, qualifying life events?
Sure.
And what is the advice for someone, let's say, who has missed that reporting window for a qualifying life event?
So the advice is, always apply. Always apply. You don't know. There's what online, what you're going to see is a questionnaire. And it's going to ask you a number of things. There might be a different qualifying event that gives you a special enrollment period. You never know. Depending on someone's income, their overall circumstances, they might qualify for Mass Health. Mass Health does not have a closed enrollment period. So these are, important things to acknowledge. If for some reason you don't, you've applied, you've called customer service, you're like, okay, there is no qualifying life event, you could file for a hardship waiver. That would give you, and it's a waiver through the Office of Patient Protection. We'll make sure to include that link in the follow-up email as well. But that is another method. It takes a little bit longer. My recommendation would be to call customer service and say, is there any flexibility based on my situation? Okay, and I think that was Nuri's signal for us to go forward. So I'm going to pass, are we okay, Nuri? Okay. All right, so Talia, I will pass it back to you.
Okay. So I just want to highlight a few ways that you could get help with completing your application. So if you need assistance with the application process, we have resources available to you for free of cost. You can receive help with your application through customer service or one of our community partners. Customer service is probably the best way to reach us, and the number for customer service is 1-877-623-6765. And we do have some local events, and you can visit this page that's on the screen here, and we can send that in the email as well, where we offer help in person completing applications. You can also set up an appointment with a certified application counselor. We call them CACs, or a navigator, and they are trained and certified to help with the application process. Assisters can be found at community health centers or hospitals and speak the languages that are most common in the communities that they work with. And I'm going to pass this on to Melissa now, where she will show you how these tools that I previously mentioned work, and she can also show you on the website how you can find a CAC or a navigator in your area.
Thank you so much. Okay, so this is my favorite part because this is where we will actually see how much you can save per month. So I'm just going to pull this up real quick. Okay, I think I got it now. Sorry, guys. Okay, so this is our page here, our cover page. And if you go on the top of the page and you hover above get an estimate, you will see two selections provided, either the individuals and families or businesses. So you want to click on individuals and families. And once you get to this page here, this is our get an estimate tool page. So you want to select the coverage year, which is 2024. And then here you want to enter the zip code. And I'm just going to use a random zip code. You want to enter what you think your household income will be for the year. And I'm just going to make up. And then the number of people in your household, including people who may not need coverage. So I'm just going to say that this is just one person who needs coverage and that this is let's say a 32-year-old. So you also want to look on the side of the age of household, and you're going to have three categories here. You want to select that this person needs coverage. And then there's two other categories that you want to also select if they do apply. And this is if the person is pregnant or this person is disabled or blind, which would put you in a different type of eligibility. But today we're just going to say that the person needs coverage, and we're going to go to the results. And this is just a reminder that this isn't an application for health coverage, and that's fine. We'll continue. So here we have a breakdown. It's an estimated eligibility. So based on the information that we had submitted, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium cost. So the maximum tax credit amount for this person would be $220. And this person will be eligible for silver plans with monthly premium as low as $142. So we see a further breakdown. So this person is potentially eligible for a connector care plan with advanced premium tax credit. So then as we go along, we want to either preview plans or apply now. So we're going to preview plans because we want to see a further breakdown of exactly how much we would be saving based off of the carrier that we would select. So here we see again, the connector care plan type would be 3B. The tax household FPL, which is the federal poverty level, would be 274.35%. And again, we see the monthly advance premium tax credit for this tax household would be $220. So that would be the savings per month if we chose to select that as an option. And then we have a further breakdown. So I'm just going to use the first example here. A person can have a carrier, the plan name, the coverage level, the monthly premium costs for this person, if they selected this plan, would be $365.21. But if they chose to take the advanced premium tax credit savings, it would be $365.21 minus $220. And then we have the Massachusetts state savings, and then we have what you would pay per month. So that would be how much you would be responsible per month based off of the savings of the advanced premium tax credit. So it's a really cool tool to go in and take a look. If you're not ready to do the application process, this is a great way to go in and see exactly how much you would be saving per month. Nuri, did we want to take any questions before I continued?
Yes, Melissa, would you mind just clarifying what would be defined as head of household and the family members? In other words, like who should be listed on the application?
Okay, so basically who should be listed in the application is the best example that I can give is the way that you would file your federal income tax. So that would be included in your household. So for example, let's just say that you are a married couple and you file jointly at the end of the year for your federal income tax. You would want to include that person in the application. Another example would be if you had dependents. You would also want to include those people in the application.
Thank you, Melissa. And regarding APTCs, do you know if someone does decide to receive those benefits, would they need to claim that as income on their tax return by any chance?
So if you do accept the advanced premium tax credit, what happens at the end of the year, you will get a form from us. And basically, when you go to file your federal income tax, you would just bring that form with you. And that would be included. Is that what you were trying to ask?
Yes.
Okay.
Sorry, Nikki, did you want to add?
Yes, I think I just wanted to clarify. Yes, the APTC amount will be indicated, as Melissa said, but you do not need to, like when you're figuring out your income, those APTCs, let's say it was $200 a month, you're not adding $2,400 of income to your application. Don't worry about it. Like it's what you're getting because of your current existing income. Does that make sense?
It does. And can you just clarify, would I necessarily get, let's say, a check or receive those benefits directly, or would it go to my carrier? Just the process of that.
Sure. So if you, and Melissa, I'm going to use your words, a really good reminder for people. You're not required to take these dollars. So if you choose to accept, let's say, the $200 a month of advanced premium tax credits, that money goes directly to the carrier. And you, as the person, as the family, you just pay the lower amount of your bill. You do not have to wait for a check from the state or anything like that.
Thank you, Nikki. Melissa, when you were going through the demonstration, you checked off a couple boxes there. It showed different options. Would you be able to, do you know if someone is determining whether or not they need to check off the disability or disabled box, are there examples of what would classify as a disability on there?
So there are no examples as to what exactly will qualify as a disability, but what happens is you're put in a different type of eligibility category, and you would actually receive more information in the mail regarding that because you could possibly be eligible for mass health. And so basically you would be guided as to what the next steps would be in regards to that.
Thank you. I'll keep reviewing questions if you want to proceed to the next step.
Okay, perfect. Thank you so much. Okay, so the next step is our provider tool. So if you go above where it says Help Center and you scroll down to Resource Download Center and you click on that, here we have the Plan Finder tool, and this is super helpful when you want to make sure whether or not your current provider is in the network, which is extremely important if you wanted to continue to have treatment with your provider if you had one. So here you'll see Plan Comparison Tool 2024. and you'll see individuals and families, and this is what we want, so we want to continue. And then we're just going to be asked a series of questions like before. So the first one here is the zip code where you live, and their zip code is here. And then question number 2, do you qualify for connector care? And we want to say, yes, we do qualify. And then we want to say, what type of plan did we qualify for? So I'm just going to say that we, qualified for a plan type 3 and continue. So here we have the provider search. So you want to enter the name of the doctor or provider. So let's just say, and I'm just going to enter a random name here. Nina Debro is my doctor. She's in internal medicine, and we continue. And then we type the facility name, and I'm just going to say Brigham and Women's Hospital. And continue. And then if we have a prescription drug that we use, we want to make sure it's in network. We enter that drug name. And I'm just using any type of example here. I'm just going to use this one. And we want to compare plans. So here, basically, we see that there's 7 plans available for this person. And it breaks everything down. So you have the plan name, you have your drug, you have the provider, and you have the facility. So for example, for the first one here, we have UHC Connector Care 3, which is the United Healthcare. So if you want to see if the prescription drug is in network, we just kind of hover above the C list here, and it says that it's not in network. Okay. And then if we continue to see if the provider is in network, we see that the provider is listed here, so that this provider is in network with this plan. And then the fact that the facility is also listed here, we see that this facility is also in network. So as you go further down, based off of your needs, you would be able to select which plan would be best suited for you. So this is a really good tool, and I suggest that people use this just to make the process better with and easier with choosing a plan. And now I'm going to go back.
Melissa, we are almost at time, so I'm not sure if you want to show the Find Local Help tool now. I'm not sure if that's where you were going next, but just
Yes, actually, that's what I was doing. Thank you so much. Yeah, great. So if we go back to the Help Center, we see that we have a selection here. So we just want to click on Find Local Help, and I'm just going to do this real quick. This is a great tool to see what resources are provided to you in your area. Having a little technical issue here. Sorry, guys.
It's okay, Melissa. We knew the snow was going to get to us one way or another today.
Yes.
While your screen's loading, I just wanted to point out a couple of things for folks. So Melissa talked about these partners, navigators, and certified application counselors that are available to help. And Talia mentioned customer service. I just want to point out that even if you've started the application and then decided, oh, I just got stopped or I got stuck, don't worry about it. If you make an appointment with one of these people or you call customer service and you give them permission, they'll be able to pick up wherever you left off and they'll help you get over the finish line. So that was the only thing I wanted to add. So Melissa, I'll go back to you.
Okay, thank you, Nikki. So yeah, this page is, just a great tool to see, our enrollment assisters such as navigators and certified application counselors. They're trained and certified individuals at organizations in your area that can help you apply for coverage. So we would just scroll down here and select individuals and families, and we could see exactly what would be available in your area. So this is just a list, and if I wanted to narrow down the list, like let's just say I wanted to see, I needed a navigator, I would click on Navigators. My computer is a little slow, I apologize. So when you click on Navigators, you would just have a list of navigators that would be in your area. And you would also have a filter to see, like, so here we have the list of navigators, but let's just say we wanted to just see the ones available in Boston. So we can filter it out even further. And we would see that the selection of navigators available in the Boston area. So let's just say, okay, that this is a great resource here. We can click on that and just get additional information. And also the address, the contact phone number, their website, and the languages spoken there. So this is a great tool if you needed help, you wanted to see what exactly where you can go in your area to find that help. This would be a great tool. All right, so yep. So I just clicked on the Boston Public Health Commission. So it just further gives information in detail regarding that. And it even gives you direction. So it's really great to have if you needed help, any type of help.
Thank you for walking us through that, Melissa. I do want to note that there are a couple of scenarios, very specific scenarios in the Q&A. So not sure, Melissa, if you would advise them to use this local help to get their questions answered, call customer service. I'll allow you to provide the advice. But let's say someone has questions about IVF or other procedures, and again, very specific scenarios. What would be your recommendation for help?
So for those specific questions, so let's just say you went and applied and you have your list of plans available in your area. There is a brief overview of a benefits summary that you can go in. You can actually click on that to see what information that's available. But if you needed further information in regards to the plan benefits and you don't see that information there, another step that you can take is actually calling the number for that plan, and you can ask them directly for those very specific questions.
Great, thank you. And a question regarding those who are self-employed. Do you guys recommend that they apply as individuals? We also have our small business platform. What is the recommendation for those individuals who are self-employed?
Yes,
Go ahead,
Nikki.
Melissa. Yep, no, go ahead.
Okay, well, for self-employed, yeah, you can still apply as a self-employed person. You would just indicate that in the application. And it's the same thing. You would just have to put in all the information in regards to the income. And then you would be able to see your eligibility based off of that information. And Nikki, I don't know, did you want to chime in on that one?
Yeah, so the only other thing I would add is that when the ACA was passed, it basically changed things so that anyone who's self-employed or like any small business owner that doesn't employ any non-family member, they're no longer eligible to get small business coverage. So for example, they wouldn't be able to go through Health Connector for Business, but instead, those self-employed person, or let's say family, you're running a very small business, you could come to the Health Connector, go through the individual and family side of the platform, and potentially even get more savings. And when we do the Health Connector for Business presentations, we always like to say, we hope that we can be there for a small business owner like every step of the way. So if it's just you're starting out as an entrepreneur, You could get your coverage through the individual and family platform. And then as you grow your business, potentially you could move on to Health Connector for Business. But just a little bit. And Nuri, I feel like we're just a little bit over time. So if are there any key questions that you'd like us to respond to, or perhaps even take in the follow-up email?
Yeah, we mentioned APTCs a couple of times, and folks were just curious to know if there are any repercussions to accepting those benefits, or in other words, why would someone not accept those benefits?
Melissa, do you want to explain?
Sure, yes, thank you. So APTCs, the advanced premium tax credit is actually an award. So we're awarding you with that to help you with your premium costs. So at the end of the year, when you go file your taxes, you would actually have to pay that back. So based off of that, sometimes people feel that, based on their circumstances, they may not accept that. But you have an option in the application whether or not you wanted to accept it. And you can actually put down exactly how much you would want to accept. But it's just basically something to help people with their monthly premium costs to make it more affordable. So it would be just something optional to you. You don't have to accept it, but it's there as a resource.
Right. And so as Melissa's saying, it's a tax implication. So sometimes with people who don't, it's hard for them to predict their income for the year. Sometimes people don't feel comfortable. Like, let's say you did qualify for $200 a month of tax credits or $400. Somebody might say, I know that's a tax responsibility. Maybe I'll only take 50% of that.
Thank you for explaining that. Alrighty, so I will allow you guys to share any last words. Just a reminder to folks that you will be receiving this recording, the materials provided, and the links to get more specific information regarding income, qualifying life events, etc. But Nikki, Melissa, any final takeaways?
Well, first, I just want to thank folks for hanging in there with us. I know we went over time, but I feel like you asked some really great questions, and we wanted to make sure that we not only answered those, as many as that we could, but also showed you some great resources and how to use them. So I'll hand it over to Melissa.
Thank you. So just a reminder that we are here to help you. We have so many resources and tools that are available to you. So if the process seems overwhelming or confusing at all, please always feel free to reach out to us. We're always here. We have a language line, and we have many of our assisters and navigators who speak different languages and can help you with the whole entire process.
Great, thank you so much. And I just want to echo my colleagues' thanks. So thank you all again for joining this webinar, and from everyone at the Health Connector, our sisters, we wish you well. Please be safe for those who have gotten snow today and who will continue to get snow, and enjoy the rest of your day. Thank you all.
Thank you.